My name is Denise A. Yardley. I'm a senior investigator at the Sarah Cannon Research Institute. Our recent annual meeting, the San Antonio Breast Conference held in December in San Antonio, has been a great source of changing therapies for patients with breast cancer, and I think also paired very nicely with an increase in the understanding and the scientific profile of tumor cells and what makes a breast cancer cell develop into a tumor and ways that we might be able to avoid that. I think when we look at that conference, it's paired nicely with clinical changes, and I think when we see this past year's conference, changes in trying to increase or continue to improve the outcomes with patients with early stage disease. One of those featured a drug called tamoxifen, which standardly has been administered for 5 years to patients with early stage breast cancer that were hormone receptor positive. This trial that was presented this year actually showed a benefit in increasing the duration of tamoxifen, and there have been a lot of questions about that. This particular trial extended the tamoxifen by another 5 years, so for a total of 10 years, and actually showed it translated into improved survival outcome for patients. I think what we really now want to focus on is this applies to all patients, or is there a specific group that may derive more benefit? We have the aromatase inhibitors as well, and they're well underway in a series of trials that are comparing 5 to 10 years and 15 years, and those trials should be reporting their outcomes in the next 2 or 3 years. So I think these are easy measures for patients because they're not chemotherapy, they're pills, they're therapies they can take at their home outside of the clinic, and I think provide them with an increased check and balance of any potential tumor cells from reactivating and increasing their survivability and curability with these now extended endocrine therapies in the management of early stage breast cancer.